to eradicate diet-related chronic illnesses for minorities by addressing social and cultural determinants. Carla is recently diagnosed with a type 2 diabetes diagnosis. In fact, someone like Carla, who's Hispanic, is 2 times as likely to be diagnosed with diabetes as those as non-Hispanic whites. She turns to her physician to ask what she can do differently in her health, and the doctor tells her to, quote, eat healthy. The question to ask there is, what tools have we truly provided Carla to enable her to eat healthy? There is a gap in market today for diabetes management. In fact, within this market, we've seen that a lot of solutions have perfected devices. However, they have taken a one-size-fits-all generic approach and not quite addressed nutrition in a meaningful way, certainly not in a way that is culturally relevant to someone like Carla. This market within the Hispanic market is 30 million people, largely underserved, and that's where we come in. At Yumlish, we are creating participant-centered care. And what that means today is we have taken existing models of diabetes prevention and diabetes management. We've adapted those models to be culturally relevant to this population that we serve, addressing their needs that are very, very specific to them. We've also added on support by registered dietitians through medical nutrition therapy, as well as through chat conversations. We further added peer support on top of that, and lastly, added in deviceless remote patient monitoring. This is what that looks like. We provide cultural nutrition therapy by way of registered dietitians, virtual classes, peer support, chat support, deviceless monitors, and all of our curriculum is pending approval from the CDC and the American Diabetes Association. The neat thing is that we have lowered barriers to adoption for this population, delivering using WhatsApp, Chrome browser or another browser, and text messaging. So there are no apps, there are no logins, and again, just lowered those barriers to adoption. Cultural nutrition therapy is effective, and we have seen that in action. In fact, through our program, we've seen people lose weight, lower A1Cs, have a high engagement rate of 73% and an attendance rate of 90%. We are focused on the Latino market because we are based in Texas and have established channels to provide our program here in Texas. Our addressable market, just by way of CPT codes, is over $1 billion. Additionally, we've had phenomenal traction here. We've already seen ourselves, in clinics here in the Dallas area. In fact, we have a clinic program going live tonight in Tennessee. Super excited about that one. We also have partnerships with UT Southwestern and Ascension Seton Health Systems based in Dallas and Austin, respectively. And through these pilot programs, we're validating a lot of our outcomes. We also have a unique partnership with school districts in Texas. And this comes out to about, and now turning to the funnel, this turns out to about 260,000 employees that we can potentially tap into through this channel. Our business model right now is dependent on CPT codes. However, we see multiple pathways into revenue for Yumlish. Part of that being added on services for the school district employer on a PMPM model. Additionally, we are looking to scale, and really, why stop there, right? So we're looking to scale using Yum AI and really using AI to make our nutrition therapy more customized and personalized to this population that we will serve throughout. We have a phenomenal team put together working on this moonshot diligently. And lastly, our ask is partnerships with payers interested in serving this population and really addressing nutrition for them. And our second ask is we're raising $750,000 in convertible debt, which is going to be used to update our existing infrastructure, really be able to validate outcomes with health partners, and also get some boots on the ground as far as sales are concerned, and really update that, update, like I said, the technology, and also hire and bring on more staff. So at Yumlish, we truly believe that we are what we eat, and we eat what we are. So join us. Thank you.
Awesome. Thank you, Shireen. I love it. Love what you guys do. Esther, why don't you come off mute and ask your question to kick us off?
Okay, so I'm aware of this issue because I work closely with another CDC, the diabetes prevention program that the YMCA is doing, and their actual nutrition advice is probably 10 years out of date, which I don't know how you handle that. It's, when you're in person, you can kind of just quietly tell people, even though this yogurt is low fat, it's really not that good for you. I'm just curious how you deal with that issue.
Yeah, so what we've done, and for that reason, in fact, what we see are nutrition education gaps in this population that we serve. So even talking about yogurt or talking about fats, those are some very basic things that we're looking to fill in terms of, nutrition education gaps. Now we have created a baseline within dietetics, within science, sort of the research and evidence-based research that we know about foods today. There's a lot of work to be done on top of that, and I completely understand, where you're coming from there, but we're really using this as a starting point. And then what we've done on top of that is really layer on this cultural element to sort of at least update it for this population specifically that we serve.
And do you train them on cooking? And I mean, are you serving the individual or the family? How do you feel about that?
Yes, so we've actually done that recently. So we do cooking demonstrations, we do salsa dancing, we do a grocery store tour, so all sorts of different things there. And then to your question about the family part, because we're offering all of this virtually, the way we've made it right now is we've really opened it up to their family members to attend with them. So family members join in sometimes when you have meals on the line with us. Their spouse has to be on to really approve the changes in meals. So we encourage family members to join, especially decision makers around food and cooking.
Thank you.
It's so important, the culturally sensitive aspect of your business. What other cultures are you looking, what other communities are you looking to target as you look to the future and to your growth?
We've had, so there's been some interesting opportunities there. We've been actually approached by a state to look specifically at the Native American population. We haven't even begun to scratch the surface there, but there's quite a bit of work to do there for us. So that's another group. The African American group is another one. So a couple of different populations to scale into for us.
Awesome. Yeah, so much opportunity there for you all to make a difference. And so when you're looking at other diabetes management platforms, can you just touch on what you would say are your key differentiators?
Yeah, absolutely, Katya. So our main differentiator is going to be this cultural nutrition therapy, just because it's largely underserved. If you look at some of the diabetes solutions out there, they're doing devices really, really well. The gap there being that no one is really looking at nutrition, and specifically medical nutrition therapy as it applies to this population. So when we're looking at it, we're specifically focused on how registered dietitians provide this nutrition therapy and how they can coach and how they can sort of impact and assess and iterate that assessment, especially as we head toward that YumAI model, but really iterate that assessment real time and provide that care in home where people are, and again, just rooted in dietetics.
Thank you, Shireen. Great job.